I'm Olivia Fierro. Can you eat fish while you're pregnant? Do you really starve a fever and feed a cold? Or is it the other way around? Dr. Sharon Thompson is in the house debunking some medical myths this hour. Good morning, Arizona. In your Health Watch this morning, we are busting some medical myths with our favorite expert, Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology. Because there are a lot of things that we hear over and over again, and of course, those of us who are not professionally trained to work in the field of medicine, we believe it if we've heard it enough times. So let's go through some of the biggies. We want to talk first about your pregnant patients. They must have a lot of questions about diet, what's safe to eat, what's not. What about fish?
Oh, it is amazing how many rumors and old wives' tales there are about pregnancy. Books could be written.
Okay.
And one of the ones that's super important is fish in pregnancy.
Okay.
Almost every woman in the country thinks that you can't eat fish when you're pregnant, and that is the opposite of what is true.
Okay.
Fish is safe and healthy in pregnancy. We want you to eat fish. There's some studies that show that several health indicators are better in pregnant women who eat fish than the ones who don't.
Okay.
There are certain kinds of fish that can accumulate mercury because that's what people worry about, and those you want to stay away from. Those are like the big cold water fish. The good news is in America we don't eat them very much.
Right.
Tilefish, mackerel, a certain type of fish called shark that we don't eat very much here, and certain types of tuna. Other fish, the ones we eat more commonly, the trout, tilapia, salmon, you can definitely have, and if you like fish, eat it a lot.
And probably better than the alternatives of what you would be eating, so that may be one of the factors.
True.
But sushi, probably a no.
Well, sushi is sometimes.
Okay.
So the issue with sushi is not the fish content, it's that you're eating something raw.
Okay.
And I like to tell my patients, pregnant women, their immune systems are a little bit lower than the rest of us. So if there's something to be gotten, they're going to get it first.
Oh, gotcha.
So anytime you expose yourself to uncooked or undercooked foods, you take a risk.
Okay. Speaking of getting something, let's talk about the lovely stuff that comes out of the nose and sometimes the mouth when we get a little cold or cough, right? We've always been told and been asked at the doctors, especially growing up, what color is your mucus?
Yes.
Why does it matter?
So what we know now that we may not have known 30, 40, 50 years ago is that viruses and bacteria both can cause our bodies to make substances of lots of colors.
Okay.
Much like my jacket.
Which is a lovely color on you, by the way.
And that the color does not make a difference in what is causing the problem.
Okay.
Most of the times when we get a cold or a sinus infection, it is caused by a virus. And what's going to make you better is time and people being very nice to you.
Yes. Yes. Kindness, rest, and a lot of fluids, right?
Absolutely.
Okay. Feed a cold, starve a fever. Yes or no?
Feed everybody. Don't starve anyone at any time.
Okay,
Food
that's
is
not good.
Always, yes. So as we talked about, when you have a cold, what you need are lots of fluids and lots of love and care and comfort foods. But don't make it go on too long, otherwise you'll get some other health problems. But you want to eat, rest well, and drink lots of fluids, cold or fever.
Okay, so keeping yourself on an empty stomach, there's no benefit to that.
No, you'll just feel worse.
Okay, a lot of your patients, I'm sure, are coming to you to talk about that they're trying to get pregnant. They're ready to get pregnant. So what about the birth control pill? You've heard about people going on the pill in order to get pregnant once they go off of it. Does that really kickstart the system, or is that a myth?
There's some use for the pill in that way, but if you are trying not to get pregnant, take your pill.
Okay.
If you're trying to get pregnant, stop taking your pill.
That makes sense.
And you don't have to stop early. So that's another thing we hear people say, oh, I'm going to stop my pill because I want to get pregnant in 4 months. You could get pregnant tomorrow. You need to take the pill every single day because it only works if you take it every single day. The day you stop taking it is the day it stops working.
Until you're ready and willing to get the good news that you're pregnant.
Go ahead and stop.
Okay. Drinking alcohol can warm you up. I mean, you've heard of, well, I mean, in my family, the medicine is the hot toddy. You're out in the cold. You need something to kind of, don't people go with the peppermint flavored liquor?
We all agree. Drinking alcohol will make you feel warmer. But this is actually pretty interesting because you do feel nice and toasty when you drink alcohol, but the reason for that is actually bad for you. So alcohol opens up the blood vessels on your skin, so nice warm blood rushes to your skin and you feel warm and toasty, but in fact your internal organs are getting colder.
What?
So if you're in a dangerous cold situation, you actually don't want to drink alcohol. It's the opposite. It can make your health condition worse.
Wow.
Yeah.
Okay. we
we're all
always
familiar with
learn
that Saint
something.
Bernard with the bottle, right? Don't drink it.
Okay, he's just got water in there.
Water.
It's for the best. Dr. Thompson, thank you so much. Dr. Thompson is going to sit down with 3TV's Facebook page and answer some more of these questions and go through. She's got a lot of lists of some of these myths that she's going to clarify.
So get on Facebook and send us your questions.
Yes, Dr. Thompson, great to see you.
Thanks for having me.
Thank you. Gina?